Okay, guys, this video is meant to be a review video or kind of like a practice exam for the anatomy and physiology, both a lab and a lecture practical on muscles and joints. So, you've seen the models that we have in class that would be used in the in-person lab practical. So this is going to be kind of like a sample of what you might expect for that exam. So I'm going to be reviewing several different models, and it probably will include more of the material here on our review than the actual exam, but in any case, it's a good review for both muscles and joints. So identify the muscles at the tip of the pointer. Okay, so this here is pointing to this kind of rectangular strap-like muscle, and that muscle is the masseter. Okay, the masseter. It's the muscle that we use for mastication or chewing. So when you clench your jaw, you can feel it on the side of your cheeks. So that's the masseter. Okay, so this is pointing to a deeper muscle, which is in the cheek. So this muscle, the tip of the pointer here, you can only see this part of it here because there's other muscles that are on top of it. So this is a deep muscle in the cheek, and remember that the cheek is referred to as buccal. So this muscle is named the buccinator. The buccinator. Okay, so the masseter was the superficial one. The buccinator was this deeper little triangle that we can drop down into. Okay, so here, this is pointing to this muscle here, the muscle of the scalp. That's right in this region here above the ear. Now remember that bone right there? It's called the temporal bone. And this region is called the temporal region. So that makes sense that this muscle would be the temporalis. Okay, the temporalis. There are a few different muscles that we need to know in the head or on the scalp, and they're all named based on the region that they're in or the bone that's under them. So frontalis, temporalis, occipitalis. Okay, pretty easy, I think. Okay, so this is pointing to this superficial strap. It kind of goes like this, the superficial strap-like muscle that's in the neck. If you twist your neck sideways, you can see it. It'll bulge. It's very easy to see here on the side of the neck. Starts back behind the ear and then comes forward and attaches to the sternum and to the clavicle. And the muscle is just named based off of the attachments that it has. So the muscle is called the sternocleidomastoid. Okay, sternocleidomastoid. Okay, so the reason for that is that it connects to the sternum right here. It attaches to the clavicle right here. And then at the top here, behind the ear, it attaches to the mastoid process, which remember was that big process at the bottom of the skull. Okay, the sternocleidomastoid. There are other muscles in the neck that we need to know that are more deep. So if we pull off the sternocleidomastoid, underneath it, you'll see the scalenes. Okay, the anterior, middle, and posterior scalenes muscle. Okay, and I'm going to show you that on a deeper model, not on the superficial one. Okay, so we're back to the face here. There are three of these strap-like muscles. One, two, three. Okay, that you guys might need to know here. The top two are attached to the zygomatic bone. Those are zygomaticus muscles. But this one that goes straight out to the side is called risorius. Okay, risorius. Okay, this is not one of the zygomaticus muscles. It's shaped like them, but it doesn't go up to the zygomatic bone. The zygomatic bone is the cheekbone up here. Okay, so that doesn't go anywhere near it. So this one goes straight out from the side of the mouth, is risorius. Okay, so these are the muscles that will connect to the zygomatic bone. There are two of them. This one right here is the inferiormost one, and then there's one just above it right here. They both go up from the corner of the mouth or the top of the mouth and go up to the zygomatic bone. They're both zygomaticus. So we have a zygomaticus minor and a zygomaticus major. Okay, this is the bottom of the two. So this is the zygomaticus major. Okay, zygomaticus, because it connects to the zygomatic bone, major. Okay, we also have a few different muscles that we have two of them, a major and a minor. You can remember minor over major. Okay, the minor is the one on the top, the major is the one on the bottom. For the zygomaticus, for rhomboid, minor and major. Um, okay, so when we go along, I'll remind you about this. So minor over major. Okay, so this is pointing to a circular muscle that circles around the eye. Okay, from the side, you can only see half of the circle here, but it goes around the eye like that, and it circles all the way around. Okay, so we have one around each eye, and we also have one that circles around the mouth. So all of those circle muscles are called orbicularis. Okay, so then we just have to say if it's around the eye or the mouth. So this one is pointing to the circle around the eye, so it'll be called the orbicularis oculi. Oculi, like ocular. Ocular is the eye. So orbicularis oculi, orbits around the eye. Okay, this is pointing to another one of the scalp muscles. Remember before we looked at the temporalis, which was on the side by the temporal region. This is pointing to the muscle which is right here in the forehead, the frontal region. So there's a couple of different ways we can name this. We can just call this frontalis, or we can call it the frontal belly of the occipital frontalis. Technically, this is connected as one muscle from the occipital region back to up here, the frontal region. All of that there is considered one muscle, and it has two bellies or two parts that are connected. So this is pointing to the frontal belly because it's in the frontal region. And then back here in the occipital region, that's the occipital belly. Okay, and the two muscles are connected by what's connected. It's called an aponeurosis. So all of this gray here that you see underneath here, that's showing you an aponeurosis, which is kind of like a tendon. It's filled with collagen, connective tissue. It's just a flat sheath. Instead of a tight bundle of a tendon, it's more like a flat sheath of connective tissue that forms this aponeurosis. So we have muscle in the front, and that's connected to muscle in the back. Okay, so this specifically is pointing to the frontal belly of the frontalis. All right. Now we're going to move down to the back. So when we look at the back, we have two muscles that are very superficial. So this one up here, which is shaped like a kite, okay, or like a trapezoid, okay? That's a trapezoid shape. So we're going to call this the trapezius. There are a bunch of other muscles that we need to know too that are deep to this, that are underneath this. So we have to pull this off and look underneath it to see the other muscles. But this right here is the trapezius. Okay, so this is when people work out their traps. They're working out like the bulge on the back of the shoulders. Okay, so those are the traps that they're working out. Okay, so this is the other superficial muscle of the back. So if you saw this question, identify the muscle at the tip of the pointer. That's pointing to this muscle. Okay, that goes kind of like this. All of that there. That superficial area at the lower back. Okay, and the sides, and the lower back. This is called the latissimus dorsi. Okay, so think of latissimus like it goes through the lateral sides, dorsi, dorsal. Okay, dorsal's the back. So people talk about working out their lats. They're talking about the latissimus dorsi. So this is the superficial muscle of the lower back. Okay, here we see the superficial muscles of the front of the trunk. This is pointing to the superficial muscle of the pectoral region. Okay, the pectoral region is the chest region, and this muscle here is it's named the pectoralis major. Okay, pectoralis major. This is the large of the pectoral muscles. So when people work out their pecs, they're working out their chest muscles right here. Pectoralis major. We'll see pectoralis minor in a second. It's a smaller one. It's underneath this. So we have to pull pectoralis major off, and then we'll see minor underneath. Okay, here this is pointing to the abdominal muscle. We have three layers of abdominal muscles. They're present like on the sides here, and then we have this central region of abdominal muscle here in the middle. So all of these abdominal muscles are named based off of the direction that the fibers go. So this muscle here that we're pointing to, okay, which is these little bands that are interconnected, okay, these that go straight up and down the center of the abdomen is called the rectus abdominis. Okay, rectus abdominis. And rectus because the fibers are going straight up and down. Okay, we'll see that oblique fibers go diagonal and transverse fibers go horizontal. So rectus are vertical fibers that go straight up and down. Like when you have a six pack or, whatever, you know, abdominal muscles, that's from the rectus abdominis muscle. Okay, this is pointing to one of the muscles of the thigh. Okay, so if we would identify this one, okay, remember, we can break them up into sections, anterior thigh, the inner thigh, and the posterior thigh. So if we look at the anterior thigh, there are four major muscles here. One, two, three. Then we have one underneath, which is a deep muscle. Okay, so this muscle here, okay, it's one of the vastus muscles. We have a vastus medialis, intermedius, and lateralis. Okay, so this is on the medial side of the leg. Okay, so the middle, remember, is called medial. So this is towards the inside of the leg. So this would be the vastus medialis. Okay, vastus medialis. Okay, on the medial side of the leg. So if I looked over here on the outside of the leg, that would be the vastus lateralis. Okay. All right, so this here, we're looking at the same kind of area on the leg. Okay, we just looked at this one here, which was the vastus medialis. And I told you guys that this one on the outside of the leg would be the lateralis. Okay, this one is pointing to the superficial muscle in the middle of the leg. Okay, so don't get confused. That's not the vastus medius, okay, or intermedius. That one is underneath this. Okay, so I would have to pull this muscle off in order to show you the vastus intermedius. What this muscle is pointing to, the rectus femoris. Okay, so femoris, it's on top of the femur. Okay, and all four of these muscles together, okay, all three of the vastus plus the rectus femoris, those are the quads. So when you talk about like working your quads, you're extending your knee, and that extension is working your quads. Those are your quads. Okay, so this question is pointing to the rectus femoris. Okay, so this is the superficial ribbon-like muscle that wraps around the thigh. Okay, so it starts right here in the front of the thigh and it wraps down to the medial side of the thigh. It's a very long ribbon, okay, and the word is kind of an interesting word, like long ribbon like word as well. It's called the sartorius. Okay, sartorius. Okay, so sartorius would be that muscle there. Okay, um, s- so this one here, it's a little bit of a tougher one. This muscle right here that we're pointing to, it's called the iliacus. Okay, and it's on the ilium. Think about the pelvic bone. You have the ilium, which is this top part of the pelvic bone that's curved up here. Okay, that's the ilium. So this is in lining the iliac fossa. So we have the iliacus. Okay, so this other muscle here that's joined with it or associated with it, okay, this one here, okay, would be the psoas major. Okay, so the answer to this question would be the iliacus. Or pointing to this one here instead, that would be the psoas major. Okay, so we mentioned this before. This is referring to one of the quadricep muscles, and this is the muscle that's on the lateral side of the thigh. Okay, so remember, this is the inside of the thigh here, medial. This is on the, look at the pinky side, okay? So this is the outside, the lateral side. So this is the vastus lateralis. Okay, the other one was the vastus medialis, okay? All right, so this is down, moving down to the bottom of the leg. Okay, so make sure you know where we're talking about. This is the kneecap here up at the top. You can see down here, this is the beginning of the foot. Okay, so the ankle and the foot. So this must be the bottom of the leg. So the bottom of the leg, again, we're going to split up into sections. Okay, so we're going to name the three in the front here. One, two, three. Okay, and then if we flip it around the back, there's a couple more that we need to know. All right, so looking at these right here, the one in the very front that's lining the tibia. Okay, so this is the tibia right here. Okay, the medial bone in the leg. Just remember your leg. Remember the medial bone in the leg is the tibia, and the lateral bone out here is the fibula. Okay, so then muscles are going to be named after the bone. So the tibia and the fibula. Okay, so this first muscle here is the tibialis anterior. Okay, and this one here, this next one over. Okay, so if you look at the next muscle over and you look at where it extends down to, okay, all the way down, okay, just follow it all the way down. You'll notice these tendons here that branch out like this, okay, to go down towards the toes. All right, so if you think about extending your toes, that will help you name this muscle. So this muscle here is the extensor digitorum longus. Okay, so the extensor digitorum longus. We have an extensor digitorum that's very similar that's in our forearm. It's in the back of the forearm in the antebrachial region, and it comes down the middle, and it has these little tendons that goes out towards our fingers, which are also digits. So that's just the extensor digitorum. This is the longer because it's in the leg, so it's called the extensor digitorum longus. Okay, so the way you can remember this is that these tendons that go out towards the digits or the toes, okay, extensor digitorum longus. All right, so now this is moving up to the top of the thigh again. Okay, so this is like the sacrum, the lumbar region. You can see the butt back here. So this is all the pelvis. Okay, so this is the thigh here. We're looking at the medial aspect of the thigh or the inside of the thigh. Okay, so there are three muscles right here that you need to know that are on the inside of the thigh. One here, and then one here. So this is pointing to this muscle here, which is at the very front of the thigh, and that's called the adductor longus. Okay, so we also have an adductor magnus. So longus is long, magnus is wide. So adduct, to adduct something is to bring it into the midline. So like if you bring your arm down, that's adduction. Okay, abduction would be bringing it up to the top, adduction back to the body. So adding it back to the body, adduction. Okay, we can adduct our thigh. So if you move your thigh in, that's adduction. Moving it out is abduction. So these muscles in the inner thigh adduct. Okay, so they're like machines at the gym. When you pull your leg in, you're adducting. You're working the inner thigh muscles. You're adducting. Okay, so this is adductor longus. This one back here is adductor magnus. This one here, we're still in the same place, still in the inner thigh. We did adductor longus, okay? Now we're moving in a little bit. Now this superficial muscle here is called the gracilis, okay? The gracilis. Okay, so now we're moving back down to the lower leg again. We can see the foot down here. We can see the tibia here. Okay, so the bone in the medial leg. Okay, so this is pointing to one of the muscles at the back of the leg. Okay, so you can see the heel back here, so that's the back of the leg. There are two large muscles back here, okay, that are pretty easy to identify. There's this superficial one, and then the one underneath. This question, the tip of the pointer here, is pointing to this muscle right here. Okay, so the one that's underneath. Okay, that is the soleus. Okay, the soleus muscle. All right, so this is the butt region. Okay, we said there are two different muscles in the butt that you need to know. So when you work out your butt, you work out your glutes, right? Your glutes. So this region is the gluteal region. Okay, so the muscles are the gluteus muscles. So there's a gluteus maximus, gluteus minimus. There's actually a medius as well. Okay, so this is the big one. This is the maximus. Okay, so gluteus maximus goes like this. Okay, gluteus maximus. Okay, gluteus medius is up here. Okay, and we can actually pull off this maximus. Okay, and we would see the middle one better. Okay, so we're going to move down to the back of the thigh. Okay, so you can see the popliteal or the back of the knee at the bottom. Okay, so again, this is the gluteus. So we're looking at the back of the leg. Okay, there are three major muscles in the back of the leg. We have one on this side, okay, one on the lateral side, and then on the medial side, we have two muscles that are stacked on top of each other. This is the one on top, and then you can kind of see there's, right here, there's kind of another one kind of like coming out underneath it. Okay, so this is pointing to the one on top, the superficial one. That is the semitendinosus. Okay, semitendinosus. The one underneath would be the semimembranosus. So semitendinosus is on top, semitendinosus on top. Okay, now this is back down at the lower leg. You can see the foot right here. This is the lateral side of the foot right here. Okay, so we're looking at the outside of the leg, the lateral aspect of the leg. And I told you guys that the bone on the outside of the leg is the fibula. Okay, so this muscle goes right along with it. The muscle right here outside the fibula is called the fibularis longus. Okay, fibularis longus. Okay, the one by the tibia is the tibialis anterior. Okay, very front of the leg and by the tibia. Okay, the fibularis longus is on the outside of the leg near the fibula. Okay, so this is the muscle of the gluteus medius when we've taken off maximus. Okay, so maximus was here before. But if we pulled it off, you can now kind of see the hip bone here, okay, the iliac crest, okay, and here we can see the gluteus medius better. Okay, so gluteal region, gluteus, the middle-sized one, so the medius. We remove the maximus. Okay, so this is showing up at the front of the thigh again. Okay, so you can see here, that's the pelvis. It comes down, tensor fasciae lata here. This is where the quadriceps muscles are. Okay, so you can see the vastus medialis here and the vastus lateralis on the outside, but the rectus femoris has been removed. Okay, so there should be a muscle here in the front of the thigh. Okay, so usually you don't have a hole there, right? The rectus femoris goes there, but we removed the rectus femoris, and now you can see the muscle underneath. Okay, remember the muscle underneath is the vastus intermedius. Hopefully that makes sense now. The vastus intermedius. Okay, the intermediate one. All right. So this is showing us the arm now. So we can see the outside of the arm, literally the shoulder. We can see the bones up here, the clavicle, and then the scapula goes back here towards the back. Okay, so this is the upper arm here, and this is the shoulder muscle. This nice, strong, triangular shaped shoulder muscle is called the deltoid. Okay, so the deltoid muscle. Okay, now moving down to the arm then, we can see the muscles of the upper arm. In the front here, we can see the biceps brachii, and underneath that the brachialis, and then the triceps brachii. So we'll see all those a little bit later, but again, this is the deltoid. Okay, so this one here pointing to the middle muscle in the arm. Okay, it's not the one in the front, it's not the one in the back, it's the middle muscle of the arm. So that one is the brachialis. Brachialis. Okay, is the arm. Okay, brachialis. Don't get confused. There's also a muscle called the brachioradialis, but that's down at the forearm. Okay, the brachioradialis because it's more towards the forearm. The brachialis is mainly in the upper arm. Okay, so this is down to the back of the arm, the back of the forearm. Okay, right here we can see the hand right here. Kind of look at how the fingers are kind of curling down. Okay, so we're basically looking at the back of the arm here. Okay, so we're looking at the back of the arm. When we look at the forearm here, we have two different compartments. The flexor compartment, which is on the palm side, and then the extensor compartment, which is on the dorsal side of the hand or the back of the hand. Okay, because that's when you extend the wrist, you use the muscles in the back of your hand, and when you flex, you use the muscles in the front. Okay, so flexors in the front, extensors in the back. Okay, so this muscle here is in the middle here, and if you follow it down, notice these tendons that go down and they split out towards the fingers. So they extend the digits. So this is the extensor digitorum. Okay, so this is like the one in the leg, if you remember, that had those tendons that went down towards the toes. That was the extensor digitorum longus. This is the back of the hand, extensor digitorum. All right, so we have a muscle on either side of the extensor digitorum. Okay, so there's this one here, okay, which is on the pinky side. So if you look down here, that's the pinky side. Okay, and there's going to be one on the thumb side as well. Okay, so there's one over here. It's actually, this model's missing the muscle, but there's one on the thumb side. They're both extensors, one on the pinky, one on the thumb side. Okay, and these are named based on which side they're on. So it would be the extensor carpi ulnaris. It's on the ulna side where the pinky is. Okay, so extensor is basically in the extensor compartment on the back of the hand. Carpi, because it comes down by the wrist, okay, like carpal, and ulnaris, because it's on the side of the ulna. Okay, so bones are important to know. Okay, the ulna is on the pinky side, the radius is on the thumb side. So the muscles that say ulnaris are going to be on the pinky side of the arm. The muscles that say radialis are going to be on the thumb side. Okay, so this is coming back up to the upper arm. We're looking at the back of the upper arm and coming up. Um, so the muscles that are right up here, up top here, that are surrounding the scapula, which is the shoulder blade. So the shoulder blade is kind of like inside of these muscles. Okay, so the shoulder blade is going to have the spine of the scapula that comes down like this. Okay, so that bone part is the spine of the scapula. And then we have a muscle that sits below the spine, and then there's a muscle that goes above the spine. Okay, so the one that sits above the spine, we said is the supraspinatus. Okay, supraspine spinatus. Okay, the one below the spine here, though, would be called, okay, is the infraspinatus. Okay, infraspinatus is below the spine. Okay, and then the infraspinatus is here. We also have this muscle here and this muscle here. Okay, so those muscles are teres minor and teres major. And remember, just like the zygomaticus, minor over major. So this is the teres minor, this is teres major. Okay, so infraspinatus would be this one. All right. All right, so here we go. This one here, okay, teres minor and okay, so this one here that we're pointing to is teres major. Okay, remember minor over major. It's the major at the bottom, minor at the top. Okay, so this is showing us the muscles of the upper arm. Okay, so we're still looking at the arm here. So this is the antecubital region, the elbow region right here. Okay, and this is the upper arm. So we're looking at the front of the upper arm. This muscle that we see here is the biceps brachii. Okay, so the reason why it's called biceps, bi means two, and if you could see the full top of this, you would see one head that goes here and another head that goes here. There's a long head and a short head. Okay, so two beginnings of the muscle. Brachii means arm, so biceps brachii. Okay, so that's the muscle at the front of the arm here that we use to flex the elbow. The back of the arm has the triceps brachii. So that's what we use to extend the elbow. Okay, so biceps brachii flexes, triceps brachii extends. And then again, right in the middle, we have the brachialis. Okay, so still looking at the arm here. Okay, same exact view that we just looked at. So we have the biceps brachii here. So this is showing us this muscle here that sits underneath the scapula. Okay, so remember at the very top of the arm here, we have all these muscles which are surrounding the scapula. A little bit ago, we saw the muscles that are behind the scapula, okay, which are posterior to the scapula, the supraspinatus, the infraspinatus. So this is looking deep to the scapula, underneath the scapula. And this muscle that sits underneath the scapula is called the subscapularis. Okay, the subscapularis. Okay, which will literally, well, it means below the scapula, literally. Okay, so here, the forearm, there's so many muscles. But the way I tell you guys to learn them is to learn the two muscles here by the elbow. Okay, so the antebrachial region, you have two muscles that make up a V here. Okay, so learn those first. Then you have to learn three that go around the back of the hand and three that go around the front. So three on the back of the forearm, three on the front, and then it becomes a lot easier. So these two here, okay, so these are going to be the brachioradialis and the pronator teres. Okay, so this one on this side, the smaller of the two, is the pronator teres. Okay. So teres major and minor are going to be up here. Okay, so pronator teres is right here. Okay, so the other muscle, this large one right here, is the brachioradialis. Okay, so remember I told you that brachialis is in the upper arm, brachioradialis is on the lower arm. Okay, because it goes down by the radius. Okay, radialis. Okay, so this is the brachioradialis. Okay, so we have these two. Okay, and then after that we have the flexors of the in the front and the extensors on the back. Okay, so here we're looking at the front of the forearm. We can see the palm of the hand here. Okay, by the way that the fingers are kind of curling up here, that shows you it's the palm. So we already named these two muscles here, okay, which are at the elbow. And I told you that there are three here in the palm that you need to know now. One, two, three. Okay, so this is pointing to the one in the middle. So if you follow the one in the middle down, it goes all the way down to the center of the palm. So this is the palmaris longus. Palmaris longus. Okay, so it comes down to the center of the palm. The other two are flexors, and they're just named whether they're on the radius or the ulnar side. Okay, so we'll look at them here. Okay, so this is the palmaris longus once again that we called which was here in the middle, right? So now we're naming this one here that's on the side of the thumb. So this would be the flexor carpi or carpi radialis. Flexor carpi radialis. Okay, the flexor carpi radialis. Okay, it's a flexor because it's on the flexor side, carpi because it comes down to the carpal region, the wrist, and radialis because it's found on the same side as the thumb. Okay, all right, so this one on the other side, okay, so we already named the pronator teres, the flexor carpi radialis, the palmaris longus. Now this one is the flexor, which is on the pinky side. So flexor carpi ulnaris. Okay, hopefully that makes it easier. Flexor carpi ulnaris. All right. All right, so here we're going around towards the back of the hand. So we just looked at all the muscles on the palm side. This is moving towards the back of the hand, back here. So we already named these two right here, right? The ones at the elbow joint. Okay, so those are already named here. So now we're moving back towards the three muscles that are on the extensor side. So the three muscles that are going to be on the extensor side, here's the first one. Okay, so we already named the one on the middle, the extensor digitorum, and then there's one on the pinky side. So this is on the thumb side. It's on the back, so it's going to be an extensor, carpi, and then it's on the thumb side, so radialis. Okay, so technically there's the longest and the brevis, but that's all right for right now. We won't get that deep in this. There's a short one, a long one, but we're just gonna call them for right now extensor carpi radialis. Okay. Okay, here, okay, we've already looked at this one before, right? So this is on the palm side of the hand. So this is a flexor carpi, and it's on the pinky side. What is it? Ulnaris. Okay, so remember that we have the one that goes down the center of the palm again, right here. We have the one on the thumb side, and then this is the one on the pinky side. So flexor carpi ulnaris. Okay, so if you follow those rules, you'll know it a lot easier. You'll understand it a lot easier. Okay. So on this one here, we're looking at the back of the upper arm. Okay, so we already looked up here at the muscles that are surrounding the scapula. Remember, the infraspinatus, the teres minor, the teres major. Now we're moving down to the back of the upper arm. Okay, so the back of the upper arm has the series of muscles that are referred to as the triceps brachii. Triceps brachii. Okay, remember, in the front was the biceps brachii. In the back, we have the triceps brachii. Tri means three, so we have three heads. Okay, so for right now, just know them all together as the triceps brachii. All right, so here, the next one we have, if we're looking at the anterior trunk again, we already named this large pectoral muscle here, which was the pectoralis major. If you look at the other side of the model, you can see that that's been removed. That's been pulled off, and you can see underneath. So this is pointing to the pectoralis minor. All right, so the pectoralis major is on top. Pectoralis minor, we said, was underneath. Okay, and then on this model in general, we can see like this side right here is showing you the superficial muscles, and then this other side is showing you what's underneath the more deeper muscles. So when you pull the superficial muscles off, what do we see underneath them? Okay, so that'll be important for the abdominal muscles. Okay, so you know, here we looked at this at the other model in the beginning, but this is the showing us the vertical muscles in the center of the abdomen. We called those the rectus abdominis. Okay, rectus abdominis. Okay, rectus means the fibers are moving straight up and down. Okay, abdominis because it's in the abdomen. Okay, so we also had two layers of oblique muscles. Okay, oblique meaning that the fibers are going diagonally. So if this side is going over here is called the superficial side. These are the external obliques. Okay, so those are the external obliques. Now this side, which is deeper, we have the internal obliques. Okay, so this would be the internal oblique. So they'd be on both sides, okay? So it's just if we pulled this external off, we would see the internal underneath. Okay, so then underneath that, we have another layer of muscles. But again, on this side, we're just talking about the internal oblique. Okay, now here we're pointing to the muscles that are between the ribs. You can see the costal cartilage and then the rib coming off like this here. And you can see that we have muscles that are sandwiched in between the ribs. And they're called intercostal muscles, which literally means in between the ribs. Okay, costals are the ribs. Okay, so that's why we call these the costal cartilages, because they're cartilage that belong to the ribs. And we have two layers of these muscles, internal intercostals and external intercostals. So this first layer that you see here, what we're pointing to, those are the internal intercostal muscles. The external intercostal muscles start a little bit further back. So it's kind of hard to see, but you can see a little bit here, there's a line, and then they go back in that direction there. Okay. So those other ones are the external. These are the external, those others that we were just pointing to were the internal intercostals, okay? More towards the back, okay? More towards okay, it's still between the ribs, but a little bit further back. Okay, external intercostals. Okay, so here we talked about the obliques. Okay, so we have external obliques, which are shown on this side. So those are the external obliques. And then on this deeper side, we have the internal obliques. Okay, now this right here, what is showing you is the aponeurosis. Um, okay, which is basically the connective tissue fibers that will cover the rectus abdominis, okay? That's why it looks like a little bit like wider than the other side. Okay, so this is showing us the deepest of the abdominal muscles. Okay, so on the lateral and the posterior, because on the lateral and the posterior aspects of the abdomen, we have three layers of muscles, the external obliques, the internal obliques, and then this deep, deep layer inside here, which is called transversus abdominis. Okay, so transversus abdominis, because the fibers are going horizontally like this, which is in a transverse fashion. Okay, transversus abdominis. All right, so here we can see the muscle of the lower leg at the posterior portion of the lower leg. So remember, we had two major muscles here. We had a superficial muscle, which is up top, and then we had a thinner muscle that's underneath. This is pointing to the large superficial bulge at the back of the calf. So that is the gastrocnemius. Okay. And there's like a C in here, gastrocnemius. Okay, so when you stand on your toes, um, you can see how your calf muscle kind of bulges. That's that region that we're talking about here. Okay, so this is moving us up to the top of the back of the leg. You can kind of see the gluteus maximus up here. You can see the popliteal region at the back of the knee here. So this is showing us what you would call the hamstrings. Okay, so the hamstrings are used to flex the knee, the muscles in the posterior thigh area. We have one on the lateral, and then we have two on the medial. So there's one on top, and then you can see there's one that kind of sticks out underneath as well. So the one on top we mentioned earlier is the semitendinosus. Okay, the semitendinosus. Okay, now the one that we're pointing to now is the one underneath. Okay, so I want you to understand that this is the one that's going towards the deeper muscle here that sits underneath the semitendinosus, and that's the semimembranosus. Okay, so the semimembranosus. Okay, so kind of think of membrane, flat, that's kind of like a flattened part underneath. Okay, or you can remember that semitendinosus is on top, membranosus is underneath it, it's on the bottom. Okay, so this muscle here that's showing us the superficial muscle of the outer thigh region, okay, kind of like the outer hip region. Okay, that's going to be the tensor fascia lata. Okay, so the tensor fascia lata. And we can also see the muscles down here of the thigh, the front of the thigh. So this would be the outside. So that would be the vastus lateralis. In the middle here, the biceps femoris. Okay, so this is asking us what are the ligaments of the knee joint. We can see that this is the femur up here, and then this is the tibia, okay, on the medial aspect of the leg. And then on the other side, we can kind of have the fibula poking out a bit. So looking at the medial aspect of the knee, we have these two ligaments that are going to be located on the outside of the knee joint, like on the outside of the knee, and those are called collateral ligaments. So we have a medial collateral ligament and a collateral ligament. You could also name them based on the bone they connect to. So there's the tibial collateral ligament and the fibular collateral ligament. So this is connecting to the tibia, so we can call it the tibial collateral ligament, or instead of tibial, we can say medial collateral ligament, because that's the medial aspect of the leg or the knee. Okay, so there's also one on the other side too. So if we're looking at this side of the knee, that's the ligament that's connecting to the fibula. So that would be the fibular collateral ligament, or we can also say the lateral collateral ligament. So this is pointing to here now, the ligament that's towards the very back of the knee. Those are the cruciate ligament, which are the ones that are inside the joint capsule. We have one that's anterior and one that's posterior. This is the back of the knee. Okay, so you don't see the patella. Okay, you can see this deep groove between the condyles. This is the back of the knee. Okay, so this is very easy to see ligament is the posterior cruciate ligament. All right, so this here is showing you one of the cartilage pads that are present in the knee. So between the femur and the tibia, where all that weight is bearing down between the bone, we have two cartilage pads. So those are called the medial meniscus and the lateral meniscus. So you just have to see what side of the knee, the more medial or the more lateral. So I know that the tibial side is medial and the fibular side is lateral. So this cartilage pad here that's pointing to is the medial meniscus. Okay, the medial meniscus. All right, and then this is pointing to this ligament here. Okay, we looked at it a second ago, but this is the ligament that attaches to the fibula. So this would be the fibular collateral ligament, or we can say lateral collateral ligament. Okay, this is pointing to the same thing here. Okay, so this here is pointing to the ligament that's on the front of the knee. Okay, I could tell that this is the front of the knee because this is where the patella is. Okay, where the patella kneecap is here within this tendon. So in order to see this ligament, we actually have to pull the patella aside, and that's what we're doing here, and bending the knee back so that you can see this ligament. So this is the front of the knee, so this would be the anterior cruciate ligament. Okay, so anterior cruciate ligament. So when people say they tore their ACL, this is what they're talking about. Okay, so this is the showing us the hip joint. Okay, so if you're taking um, anatomy with me, then um, we already kind of went through this. So this is the hip joint of the pelvis. So this is the ilium, the pubic bone of the front, and the ischium would be in the back. And basically, that's how these ligaments would be named. So whether they're attached to the pubic bone, the ischium, the ilium, and they all come to attach to the thigh, which is a femur. So this ligament here that attaches the femur to the ilium is called the iliofemoral ligament. Okay, the iliofemoral ligament. And then this one here is attaching to the pubis, okay, the very front here of the pelvis. So it's connecting the pubic bone to the femur. So it'll be called the pubofemoral ligament. Okay, so pretty easy. Pubofemoral ligament. All right. Okay, so this is showing us the back of the hip joint. Okay, so the bone down here, the back of the pelvis is the ischium. So this ligament here is attaching the ischium to the femur. This ligament would be called the ischiofemoral ligament. Okay, so ischiofemoral ligament. Okay, so the last thing here of the hip joint is you'll see here there's a little bit of a connective tissue band that circles around the joint, and that what circles around the acetabulum. So think about the hip joint. The pelvis has this deep cup right here where the femur sits to form that ball and socket joint. So the acetabulum is the connective tissue that curves, I'm sorry, the acetabular labrum is the connective tissue that curves around to try to deepen the cup and hold the femur in place a little bit better. Okay, so that's a labrum. Okay, so that's the function of a labrum, but this specifically goes around the acetabulum. So we're going to call this the acetabular labrum. Okay, so a few more things to just look at the different classifications of the joints. So when we classify the joints, we can classify them structurally or functionally. Okay, so right off the bat here, the question says identify the functional classification of this joint. So you need to know what classification is functional and which is structural. So the functional classification describes the amount of movement that the joint allows. So the three classifications are arthrosis, diarthrosis, and synarthrosis. Okay, so if it asks for the functional classification. If it asks for the structural classification, the choices are fibrous, cartilaginous, and synovial. Okay, so this specific example, okay, so if a joint is fibrous, it's a synarthrosis. If a joint is cartilaginous, it's an amphiarthrosis. And if a joint is synovial, it's a diarthrosis. Okay, for most examples, they'll match up like that. Okay, so this is showing us the intervertebral joint. Okay, so the joint between the vertebrae, where we have two vertebral bodies coming together with a cartilage disc between them. So this is asking us for the functional classification. This joint is a amphiarthrosis. Okay, see, amphiarthrosis. Okay, so this is going to be a joint that allows a little bit of movement. It's not highly movable, but each of these joints allows for slight little movement as we flex and extend the spine. Okay, now this is asking us for the structural classification of the joint. So remember, the structural classification of the joint is fibrous, cartilaginous, and synovial. Okay, so you should know that as well. So this joint here is going to be a cartilaginous joint. Okay, cartilaginous joint. So not a lot of space between the bones, and they typically have this thick cartilage pad in between them. Okay, so identify the functional classification of this joint. Okay, so the functional classification again is how much movement it allows. Okay, so this is the hip joint. So the hip joint allows a lot of movement. So this would be a diarthrosis. Okay, so if a joint is a diarthrosis, it allows a lot of movement. Synarthrosis, no movement. Okay, so the diarthrosises can be in different positions. You can move it in different positions. Diarthrosis, different positions. Synarthrosis, they're always in the same position. Okay, synarthrosis, same position. Okay. Okay, so identify the structural classification of this joint. Okay, so structurally, the hip joint here is referred to as a synovial joint. Okay, synovial. Okay, identify the specific type of joint. Okay, so in the lab we talked about the specific types of synovial joints. So the hip, the shoulder, and the elbow and the knee. Okay, we have all these different types of joints. So if I tell you I want you to give you the specific type of joint, okay, don't tell me diarthrosis or synovial. Tell me the specific kind of joint that this is. So the hip joint is a ball in socket joint. A ball and socket. The shoulder is another example of ball and socket joint. Okay, so there's a ball and a deep socket. Okay, so specific type of joint. This is showing us the knee joint. Okay, so the knee is a hinge joint. Okay, so that's the same thing at the elbow. Okay, so the joint between the humerus and the ulna. Okay, that's a hinge joint. It allows movement against this one plane, this flexion and extension, a hinge joint. Okay, identify the specific type of joint. Okay, so this is an intertarsal joint, so a joint between the tarsal bones. Okay, the tarsal bones are relatively square bones, and the joint between them has these flat surfaces or flat planes that glide along each other. So this is a plane joint. Okay, so if I showed you the carpal bones, that's the same thing. Those are plane joints. Okay, so here identify the specific type of joint between the first metatarsal and the carpal, the first metacarpal. Okay, so the one of the thumb and the carpal bone that it sits on, this is kind of like a rare instance of a saddle joint. Okay, so this is the specific example that I want you to see for a saddle joint. It literally looks like a saddle. It's sitting on the horse's back, okay, for a saddle joint. Okay, here, again, the specific type of joint, all of these joints between the metacarpal bones and the phalanges, or the interphalangeal joints. Okay, these are condylar joints. Okay, so it's a condyle, a nice long process that fits in a nice little depression. Okay, condylar. Okay. Okay, identify the structural classification of this joint. Again, structural means that it must be fibrous, cartilaginous, or synovial. So this is the joint between the skull bones. Okay, remember the skull bones are different bones when we're first born, and then as we age, they fuse together. So ultimately, when they fuse together, they have this strong fiber that interweaves them and holds them very firmly together. So this would be a fibrous joint, fibrous joint. Okay, so the functional classification of which these joints do not allow any movement. Okay, so you don't wiggle your skull bones, right? So there's no movement here, which means that they're always in the same position. So as for same, these are synarthroses. Okay, synarthrosis. Okay, um, next thing here, okay, types of movement. Okay, so several different types of movements to know here. Rotation, circumduction, abduction, adduction. Okay, so this is kind of the way a question might be shown to you. Okay, so identify the type of movement here. Okay, so this is the movement that's starred right here. You can see that the arm is moving in this direction. Okay, so the elbow is moving from the first position to the second position, that is flexion. So the answer to this would be flexion. Okay, you're decreasing the angle between the two bones. So that's flexion. Okay, the other one here, the opposite of that, where we're from there and then moving it down to that lower position. Okay, moving the opposite direction on this one, we're increasing the angle between the two bones. This would be extension. Okay, so again, lots of different movements. Okay, I don't have all of the examples on here, but you should be comfortable with the different types of movements, okay? All right, so I hope this has been helpful. This doesn't encompass every single possible question, but it's a lot of material. If you feel good, if you feel comfortable with what we've gone through so far, then you should be just fine on the exam. If you're lost still, then definitely go back.